Hello student, today I will discuss two diseases, rabies and AIDS. Rabies, a type of rhinovirus caused rabies, which is a fatal disease of the central nervous system. The virus is transmitted by animal bite. It grows and reproduces in animals such as dog, bat, jackals, monkey, cat and squirrels, etc. An animal affected by the disease is called rabbit. When a rabid animal bites a human, the virus enters the person's body. Rabbit, rabies affects the central nervous system of the patient, who died within 5 days of the onset of the disease. What is the symptom? What is the symptom of rabies? The symptom of rabies start with headache and fever. This is followed by salivation, muscle suspense in the throat, and period of excitement and depression. Finally, the throat muscles become paralyzed and the patient is unable to swallow and drink water. This leads to a fear of water. Human rabies is therefore also called hydrophobia. इसका कंट्रोल क्या है? Once the disease develops, no drug can save the patient. Our best chance of surviving after being bitten by a rabid animal is to eliminate the virus before it affects the central nervous system. Prevention after an animal bite. There are some steps should be taken to prevent rabies when an animal bites a person. First, the bite wound should be washed immediately with soap and water. This removes most of the virus. Second, the patient should then receive an antibody serum shot. Anti-rabies serum shot. Third, this should be followed by a course of vaccine shot. Older vaccines required 16 injections. Newer vaccine required 5 injections given over a period of time. The vaccine used most commonly nowadays are HDCV, Human Diploid Cell Vaccine, and RVA, Rabies Vaccine adsorbed. The first anti-rabies vaccine was developed by the famous French scientist Louis Pasteur in 1822 to 95, who was also the first to identify the rabies virus. General preventive measures. Pets such as dog and cat should be given anti-rabies vaccine. Stray animal should not be allowed to roam our street. All those who handle animal regularly should be take anti-rabies vaccine. Second is AIDS. AIDS stands for acquired immunodeficiency syndrome. It is a deficiency of immune system acquired during the lifetime of individual, indicating that it is not a congenital disease. पैथोजन क्या है? The pathogen of this disease is HIV, human immunodeficiency virus, a name given by 1986 by International Committee on Viral Nomenclature. The virus belongs to the group of viruses called retrovirus, which have an envelope consisting of lipid bilayer derived from host cell membrane and projecting knob like glycoprotein spikes with pedicel formed of virus coated glycoprotein. This AIDS, तो इसका काउज क्या हुआ? Caused by human immunodeficiency virus or HIV. HIV gradually reduces the efficiency of human immune system. It destroys the body's ability to fight disease. This makes the body vulnerable to other life-threatening disease that finally cause the patient death. How does a person get affected with HIV? This virus is transmitted through blood, semen, and breast milk. Thus, a person can get HIV by transfusion of infected blood, sharing of needle with an infected person, or having sexual intercourse with an infected person. An unborn child can get the infection from the mother. Mother milk can infect an infant. HIV is not contracted by touching an infected person, nor can be contracted by breathing in the virus when the patient coughs and sneezes. Symptom. The common symptoms of AIDS are swollen lymph gland, weight loss, frequent fever, night sweat, and diarrhea. The disease may affect the central nervous system. And both of the disease, AIDS and rabies, both affect on CNS, which may cause memory loss and deficiency and difficulty in speaking. अब इसका कंट्रोल क्या है? No drug has yet been developed to cause AIDS. A patient is usually given a combination of drugs that manage to slow down the progress of the disease. Scientists are working on drugs that promise to cure this disease in the near future. Prevention. To prevent HIV infection, we should follow the safe practices. First, we should make sure that the blood used in transfusion for our family member or us has been screened for HIV. Blood bank and hospitals should test potential blood donor for HIV. Second, disposable needle and syringe should be used. Third, we should not share shaving blades or razors. Fourth, we should not have multiple sex partner. Condoms can be used to prevent the transmission of HIV through sexual fluid. So, people who are at the high risk and getting AIDS infection includes पहला क्या हो जाएगा? Individual who have multiple sexual partner, drug addicts who take drug intravenously, individuals who require repeated blood transfusion, children born to an HIV infected mother. ये सभी क्या है? High risk of getting AIDS infection. Third क्या है? It is important to note that HIV or AIDS is not spread by mere touch or physical contact. फिजिकल कांटेक्ट और टच से ये स्प्रेडिंग नहीं होता है. इट स्प्रेड ओनली थ्रू बॉडी फ्लूइड. हेंस इट इज imperative for the physical and physiological well-being of infected person that they are not isolated from family and socially. There is always a time lag between the infection by HIV virus and appearance of its symptom. This period may vary from a few months to many years, usually 5 to 10 years. तो ये आपको हो गया एड्स एंड rabies. Influenza, diarrhea, hepatitis are completed, and after that we will discuss prevention of infectious disease. Please, all the students, make a short note and also prepare question and answer.